OET Listening Part A, Extract 1, Questions 1 to 12. You will hear a consultation between an endocrinologist, Dr. Patel, and a patient named Mr. Lawson, who has been referred for persistent fatigue and weight loss. You now have 30 seconds to look at the notes. This is official listening sample test of OET by Dr. Nasir.
Good morning, Mr. Lawson. I'm Dr. Patel, the endocrinologist your GP referred you to. How have you been feeling lately?
Morning, Doctor. Honestly, not great. I've been feeling completely drained for months now. Even small tasks like getting dressed make me exhausted.
I see. When did you first start noticing this lack of energy?
Probably around 6 months ago. It's gradually gotten worse. At first, I thought it was just work stress, but even after I took time off, it didn't improve.
Has anything else changed during this time? Your appetite, sleep, or mood?
My appetite's gone down, and I've lost about 7 kilos without trying. I'm sleeping more, but still wake up feeling weak. Sometimes I feel dizzy when I stand up suddenly.
Dizziness on standing can suggest low blood pressure. Have you ever fainted?
Once, actually. I stood up quickly after lying down, and the next thing I knew, I was on the floor. It scared my wife.
Understandably. Do you get headaches, nausea, or abdominal pain?
Yes, mild nausea now and then, especially in the mornings. No severe stomach pain, though.
How about your salt cravings or changes in taste?
That's interesting you mention it. I've been adding extra salt to my food lately. It's like nothing tastes right unless it's salty.
That's quite typical. How about your skin? Any change in color or darkening?
My wife says my skin looks tanned even though I haven't been outside much. My gums look darker too.
That's called hyperpigmentation, often seen in adrenal disorders. Have you had any recent infections or long-term illnesses?
I had pneumonia about a year ago, but nothing else chronic.
Are you on any regular medications like steroids, inhalers, or hormonal treatments?
I was on steroid tablets for my back pain for about 3 months last year, but my GP told me to stop them suddenly once I felt better.
That's important information. Suddenly stopping steroids can sometimes suppress the adrenal glands. The symptoms you describe, weight loss, fatigue, salt craving, and darkened skin, suggest adrenal insufficiency, also known as Addison's disease.
Oh, I've heard of that. Isn't it when your body doesn't make enough hormones?
Exactly. The adrenal glands, which sit on top of your kidneys, produce several hormones, mainly cortisol and aldosterone. When these are deficient, the body struggles to maintain blood pressure, fluid balance, and energy levels.
That explains the low blood pressure and tiredness then.
Yes. Low cortisol causes fatigue, and reduced aldosterone leads to salt loss and dehydration, making you lightheaded.
How do you confirm if I have this condition?
We'll start with a blood test early in the morning to measure your cortisol level. If it's low, we'll perform an ACTH stimulation test to see how your adrenal glands respond.
And if they don't respond properly, that confirms it?
Correct. We'll also check your sodium and potassium levels, as they can be affected too.
What causes it in the first place?
The most common cause is autoimmune destruction of the adrenal glands. Your immune system mistakenly attacks them. In your case, it might also be related to previous steroid use.
I see. Is it treatable?
Yes, very much so. Treatment involves replacing the missing hormones. We use hydrocortisone tablets to replace cortisol and fludrocortisone to replace aldosterone.
Will I have to take them forever?
Usually, yes, it's lifelong therapy, but most patients live normal, healthy lives once properly managed.
Are there any side effects from those medications?
If the doses are right, side effects are minimal. Taking too much can cause weight gain or mood changes, but we monitor you closely to prevent that.
What happens if I miss a dose?
Missing a dose can make you weak or dizzy. If you're unwell, injured, or have surgery, your body needs more cortisol, so you'll need to increase your dose temporarily. We'll teach you how to adjust it.
And if I can't keep pills down, say I'm vomiting?
Then you'll need an emergency injection of hydrocortisone. I'll give you an emergency card and kit to keep with you at all times.
That sounds serious. Can it become life-threatening?
Yes, if untreated, it can lead to Addisonian crisis, a sudden drop in blood pressure and shock. But with regular medication and awareness, this can be avoided.
Should I avoid anything in my diet?
Maintain a balanced diet. You may need a bit more salt than average. Avoid excessive caffeine or alcohol as they can worsen dehydration.
Got it. Does stress make it worse?
Definitely. Physical or emotional stress increases your body's demand for cortisol. You'll learn to double your dose during infections, injury, or severe stress.
That's helpful. Will this affect my ability to work?
Not significantly once treatment begins. You might need some time initially to regain strength. Carry your medical ID at all times.
All right. And what about travel?
Always carry extra medication and your emergency kit. Avoid extreme heat, stay hydrated, and have a doctor's note explaining your condition in case of emergencies.
Understood. How soon will I feel better after starting treatment?
Usually within a week or two, energy improves noticeably. Weight and appetite normalize gradually.
That's reassuring. Is exercise okay?
Light exercise is encouraged, but avoid overexertion until we stabilize your hormones.
Thank you, Dr. Patel. I feel much clearer now.
You're very welcome, Mr. Lawson. I'll arrange the test today and review your results next week. We'll start hormone replacement promptly if results confirm adrenal insufficiency.
Perfect. Appreciate your time.
My pleasure. Take care, and remember, if you ever feel unusually faint or confused, seek medical help immediately.
OET Listening Part A, Extract 2, Questions 13 to 24. You will hear a consultation between a cardiologist, Dr. Lewis, and a patient named Mrs. Carmichael, who has been referred by her general practitioner for episodes of chest discomfort and palpitations. You now have 30 seconds to look at the notes. This is official listening sample test of OET by Dr. Nasir.
Good afternoon, Mrs. Carmichael. I'm Dr. Lewis, the cardiologist your GP referred you to. How are you feeling today?
Hello, doctor. I'm okay, thank you. I've just been a bit anxious about these chest sensations I've been getting lately.
I understand. Let's go through your symptoms carefully. When did these episodes start?
Around 3 months ago, I'd say. At first it was just occasional, but recently I've been getting a dull ache along with it, sometimes after walking up the stairs or even while sitting quietly.
All right. How long does each episode last?
Usually only a minute or two. It's not like crushing pain, more like a tight pressure, mostly on the left side.
Does the discomfort spread to your jaw, arm, or back?
No, it stays in the chest area. It doesn't happen with exercise all the time either, so my GP didn't think it was angina.
That's an important distinction. Have you noticed any skipped heartbeats or pounding sensations during those moments?
Yes, definitely. My heart feels like it's jumping or skipping a beat. Once or twice, I've even felt a little dizzy or breathless.
Have you ever fainted or completely lost consciousness?
No, never fainted, though I've had to sit down a few times because I felt lightheaded.
All right. Have you had any recent illnesses, like chest infections, fever, or severe fatigue?
I had a viral infection about 4 months ago. Fever, sore throat, the usual. But I recovered fine.
Understood. Do you consume caffeine or energy drinks frequently?
I drink 2 mugs of strong coffee every morning, and sometimes a cola with lunch.
Excess caffeine can sometimes make palpitations worse, so we'll talk about reducing that. Now, I've reviewed your ECG and echocardiogram results. The findings suggest something called mitral valve prolapse. Have you ever heard of that before?
I've heard the term, but I don't really know what it means.
The mitral valve lies between the left atrium and left ventricle of your heart. In some people, one or both leaflets of that valve bulge slightly backward into the upper chamber when the heart contracts. That's called prolapse.
Oh, so that's what's causing the fluttering.
Exactly. When the valve doesn't close tightly, a small amount of blood may leak backward. We call that mitral regurgitation, which can trigger palpitations or mild chest discomfort.
Is it dangerous?
In most cases, no. Mitral valve prolapse is usually benign, meaning it doesn't lead to heart failure or life-threatening problems. But in a small number of patients, especially if the leakage increases, it can cause complications. That's why we monitor it.
I see. So how do you confirm that's definitely what I have?
The echocardiogram is the key diagnostic test. Yours shows a mild degree of leaflet bulging with trivial regurgitation. Nothing severe. Your ECG is otherwise normal.
That's a relief. What symptoms should I watch out for?
If you notice worsening shortness of breath, swelling of ankles, or increased fatigue, you should contact us. These could suggest your valve is leaking more significantly.
Okay, what's the treatment then?
For mild cases like yours, no surgical treatment is required. We usually manage it conservatively with lifestyle measures, limiting caffeine, maintaining hydration, managing stress, and doing moderate exercise.
That's good. What about medication?
Some people benefit from beta blockers to reduce palpitations and slow the heart rate. They also help with anxiety-related symptoms.
I see. So it's not something I was born with?
It can be either congenital, present from birth, or acquired later in life, often after infections or changes in the heart structure. Many people have it without ever realizing it.
Interesting. My mother used to complain about skipped heartbeats too. Could it be hereditary?
There is some familial tendency, yes. It can run in families, particularly in women.
I sometimes feel pain when I take a deep breath. Is that related?
Possibly not. That kind of sharp pain is more often musculoskeletal, coming from chest wall muscles or nerves. The discomfort from prolapse is more like pressure, not stabbing pain.
That makes sense. I thought it might be lung-related.
No, your chest x-ray was clear. Lungs look fine.
So I don't need surgery or anything drastic?
Not at all. Surgery is only necessary in severe prolapse, with major regurgitation causing heart enlargement or breathlessness. Yours is mild. We'll recheck it every 12 to 18 months with an echo scan.
All right. Should I change my diet?
Focus on heart-healthy foods. Reduce excess salt and caffeine. Avoid overuse of decongestant medicines that raise heart rate. Maintain a balanced diet rich in magnesium and potassium. These help stabilize rhythm.
Got it. Can I still exercise?
Yes, but keep it moderate. Brisk walking, swimming, yoga. Avoid high-intensity or competitive endurance activities that strain the heart.
Sometimes when I'm stressed, the palpitations get worse. Is that connected?
Definitely. Anxiety triggers an adrenaline surge, which increases heart rate and amplifies prolapse sensations. Techniques like mindfulness and slow breathing exercises help control that.
Should I carry any medical alert card for this?
It's not mandatory, but you can note it in your medical records. If you ever undergo dental or surgical procedures, inform your doctor, though we no longer routinely give antibiotics for prevention as we used to.
That's useful to know. Will it get worse with age?
Sometimes, yes. The valve tissue can become more elastic and floppy with time, but regular monitoring helps us detect any changes early.
All right. How often should I come for follow-up?
Every 12 months is fine, unless your symptoms change. If you experience rapid or irregular heartbeat, swelling, or fainting spells, seek immediate review.
Okay. Thank you, doctor. You've really eased my mind.
My pleasure, Mrs. Carmichael. I'll provide a written summary of lifestyle advice and book your next echo for next year. Try to limit caffeine and manage stress. Both will make a big difference.
I'll definitely do that. Excellent. Take care, and let's stay in touch regarding your progress.